All right. Good morning, everybody. Thank you for joining this morning. My name is Dayton Opel. I'm an orthopedic surgeon. I am a hand and upper extremity surgeon. And what that means is after I became an orthopedic surgeon and went through all the training and board certification for that, I additionally went and obtained hand to shoulder, just purely upper extremity fellowship training. And that's additional training that then allowed me to get separately board certified in treatment of all conditions from the fingertip to the shoulder. And so now I've been in practice here in the Madison area for the last 5 years, and I'm very excited to continue to bring some of the expertise and care for all the hand to wrist to elbow and shoulder problems and subspecialty issues, and bring some of the great care here to the people of this area. So thank you for having me this morning. And what I'm going to talk about this morning is really just going through a list of 10 of the most common diagnoses and causes for anyone to have hand or wrist pain or any issue with their hand and wrist. So hopefully this is helpful for you, and we're going to go through these top 10 conditions here and talk about what are some of the ways that we can treat them both conservatively and also discuss therapy and injection and surgical options as well. And if anybody has any questions at any point, please, we'd like to keep this as informal as possible. So just please interrupt me, shoot me any questions, and I'll pop over and do some examinations and give a couple diagnoses here as well. So we're going to talk about where along the hand, the finger or the thumb, on the palm side, the back side, where's the issue located, what could it be related to, nerves, tendons, muscles, bones, joints, and what are some of the options, whether it's bracing, splinting, medications, therapy, injections, surgery. The first one we'll discuss is carpal tunnel syndrome. What carpal tunnel syndrome is a compression of one of the main nerves as it's crossing from the forearm into the hand. And the symptoms that can be experienced really can include anything and everything that will affect the hand. Pain, stiffness, numbness, tingling, aching, weakness, discoordination, a sense of clumsiness with the hand. And it can all be related to the nerve, which is depicted in yellow here, as it's crossing from the forearm and the wrist. It is tightly squeezed and compressed across the wrist and the hand and the base of the palm. And that typically will affect, if there's symptoms like numbness and tingling, that will typically affect the distribution here shown in the blue, which is more on the thumb side of the hand. But the truth is, pressure there and irritation can really be felt by the patient as affecting the whole hand in a lot of cases. What the options to treat this and make this better are include splinting and bracing. And what that does is, if you can wear a splint or a brace across the wrist, that keeps the wrist in a more neutral position. That's been shown to exert the least amount of pressure on that nerve, as opposed to this position or when you're active and moving the wrist. This condition can continue to progress despite splinting. Splinting can maybe keep it at bay for a little bit, but it will continue to progress in most patients to the point where more is needed. And what more can include can be things like an injection of anti-inflammatory in and around that nerve in the carpal tunnel. And what that works to do, that injection, that anti-inflammatory really works well to decrease swelling and inflammation around the nerve and the tendons, and that can actually decrease the pressure around the nerve. That is typically a temporary response. A lot of times there's so much mechanical pressure pushed down on the nerve that injection is not uniformly predictable at managing these symptoms. And so the gold standard for the treatment of this is removing the pressure from that nerve, and that would be with the carpal tunnel release. The way that we do this now is with a quick 5-minute surgery with a very small incision, 2 stitches at the base of the palm. And we make a small incision to kind of get underneath the skin. And then from the region of kind of the mid palm all the way into the forearm underneath the skin, we're getting pressure off of that nerve. And so that's a very low risk, very quick, very high reward, high patient satisfaction surgery to undergo. That, after 5 minutes, you wake up with a soft dressing. You're allowed and encouraged to have immediate full use of your hand and fingers and get them moving and do as much lifting as you can tolerate as soon as you can right after surgery. No therapy involved with the recovery for that. And that can do wonders for simply just getting the pressure off of that nerve and what that can do for the hand. Another very common diagnosis of an issue that can affect someone or bring a patient in if they're having pain or discomfort could be related to a cyst, also known as a ganglion or a ganglion cyst. And these can come in any location across the hand and the wrist. Some of the common locations are kind of on the palm side of the wrist and the back side of the wrist, anywhere along the palm or the finger or the palm side, and then even on the back side. These cysts are accumulations of fluid, whether it's fluid that the joint is normally producing but overproducing for some reason, and that can kind of herniate out from the joint and put pressure on bypassing tendons or put pressure on some of the nerves around that area. And sometimes they can happen spontaneously, and the cyst in and of itself can be the reason for the pain and the discomfort. Or sometimes the cyst can be secondary. There could be something causing irritation to the joint that is wanting it, or the tendons that are wanting them to overproduce this fluid, and the cyst can then form. Yes, you can consider treating the cyst, but you have to figure out what the underlying issue may be that might be causing the cyst. And so depending on the location, the options to manage the cysts include things like injections and aspirations in the office that we can do. And many times, if the cysts are recurrent or they want to come back, or they're large and in a location where they get in the way of the motion of the joint, then that is another very low risk surgery to remove the cyst. And that's something we do very commonly, and those are surgeries that are also typically followed by immediate return to full use and full motion. Another common cause of wrist pain, one of the most common causes of pain across the wrist, is a tendinitis that occurs on the thumb side of the wrist. And we call this de Quervain's tendinitis or tenosynovitis. And what this is related to, and this pictorial here shows the tendons that are crossing the wrist, and they're tendons that control the thumb and the motion of the wrist. As they're passing by the wrist here, they're tightly squeezed to the bone. And this is another situation where it's pressure around the tendons that can cause irritation and inflammation. The tendons can get swollen, and as they're having to pass through this area, that can cause more friction and more abrasion and worsening swelling, worsening inflammation, to the point that any little motion of the wrist or the fingers really causes severe pain all around the wrist and even into the thumb and the hand. And what it's related to is pressure across those tendons that has really caused this horrible, inflammatory, painful response. The options to treat and manage this one, and this one is nice in the sense that we can always resolve this. We can always resolve this issue, whether it is with splinting and allowing those tendons to calm down and the inflammation to shrink and decrease and run its course, or whether it is with a topical anti-inflammatory, something you just rub on the skin that can sink underneath the skin and help with the inflammation, or we can inject the anti-inflammatory in this location. That's very successful at calming down that inflammatory response. In many patients, if it's a condition that can keep coming back, then the gold standard, the definitive treatment for it, is the surgical treatment, which is again a 5-minute surgery done with a very small incision that we make to get underneath the skin, where we're then taking the pressure off of those tendons from kind of the base of the thumb all the way across the wrist. And it is as simple as releasing the pressure that's being put upon those tendons, and that solves that issue. And again, this is one where you after the procedure, you're allowed and encouraged to get back to full immediate use of the hand. The most common concern related to joints and the normal wear and tear of joints that will bring a patient in is related to arthritis that happens at the base of the thumb. The base of the thumb and the joint that's at the base of our thumb has a special ability to have this rotation that these fingers don't have. And part of the price that we pay for having this extra motion at that joint is that joint is often the first joint that will begin to cause patients symptoms from normal use and normal wear and tear. And this increases with age and with use. And those symptoms, the joint is kind of at the base of the thumb as it joins the wrist. And it's a joint that kind of wraps all the way around this location. And so the symptoms are typically felt as, pain in this location, which is again, almost the whole wrist, the whole thumb, this whole side of the hand. What this looks like on X-ray is, as we can see here on this X-ray, this is a hand image like that. And this is quite severe advanced arthritis of this joint. And what you can see that looks like on X-ray is the normal space where there should be cartilage that moves smoothly and allows the joint to move smoothly, gets worn down from the motion and the use over the years to the point where the bone starts grinding on bone, and the bone of the thumb that leads it up into the thumb starts slipping and eroding its way through that bone as it worsens and progresses. And so that presents as continued pain, sharp pain, dull pain, aching, can affect anywhere, mostly on the thumb side of the hand, but really the whole hand and wrist. And that's related to the degeneration of that joint. This one that has many treatment options, and from most conservative to surgical, what those include are bracing and splinting. And how that works is just by immobilization. You wear a brace and a splint that kind of prevents you from moving that bone and that joint as much. And so that allows you to still kind of use your hand while taking a little movement out of that joint. And that has limitations as well. And of course, the bone will continue to grind the more you try to use that. To manage pain and symptoms, we go after the inflammation. And again, some of the options for managing the pain and the symptoms from this, besides the bracing, is a topical anti-inflammatory that can be successful for decreasing some of the inflammation and symptoms. And it's even a location where frequently we give injections of anti-inflammatory using a very little needle to sneak into that joint, and we inject a long-lasting, very high-powered anti-inflammatory that can persist in that joint for months and months, and will take away, in good cases, all of the pain and inflammation, while of course not affecting the fact that there still is degeneration in that joint and bone on bone in that joint. And the drawback with injections is we know that they're temporary, they'll always wear off. And in some patients, they're extremely effective, 100% effective at resolving the pain. And in some patients, they're not as effective. When it comes to the surgical treatment of this condition, it's something that has changed and evolved and improved over the last several years and decades. And now how we do the surgery is, it's about a 25-minute surgery that we do through a small incision right at the base of the thumb. And what we have to do is we have to remove this bone. We have to get that bone out. It's a bone that's surrounded by 4 other bones, and it ends up becoming the epicenter of the arthritis in this location. And this joint starts to grind bone on bone, and the other small joints start to grind bone on that as well. So this is a surgery where through that small incision, that bone is removed. And then without having to use any metal or without having to use any implants or drill through any bones or anything like that, which used to be how a lot of the surgery for this had been done and still is in many locations. But just by using your own tissue, the patient's own tissue, we were able to reconstruct this space with soft tissue to create a cushion for the foundation of that thumb and that joint, so that when the patient wakes up from that surgery, and it's a surgery where, again, they go kind of immediately into a removable splint and start working on getting all their motion and all their function back. And it immediately allows them to get using that hand and wrist and thumb, and when they are using it, it's now has a nice cushion in there as opposed to a bone grinding on bone. So, and that is a very successful surgery for greatly improving and resolving pain in that location that's due to the degeneration of the bone in the joint.
How long is the rehab on it?
The rehab on that is anywhere from a couple weeks to a few months. And what it looks like is we get you into a removable splint within a week from surgery. No cast, nothing like that. You have a couple stitches that are removed at 2 weeks. And by that time, we are already hoping to see that you're getting motion back in that joint. And the truth is, it does take a few weeks, a couple months for that area to heal and biologically for that area to heal and get stronger. And so some patients, by a week or two, are feeling really good and getting back to a lot of things that they like doing. But for some people who want to do more aggressive activities, like putting a couple 100 pounds of force through a torque wrench on, and some of the mechanics that I do the surgery on, it can be a couple months or a few months before they really feel like they've got all that strength back to be able to operate that. So that's what the timeline looks like for that. Okay. Dupuytren's contracture is a condition that has a very strong genetic or hereditary linkage that results in thickening of the skin and the tissue directly underneath the skin that can result in contractures setting in that affects the palm and the fingers. It's extremely common. It's one of the most common conditions that will bring a patient in to come see me. And it can present as a slow process of noticing thicker skin. Sometimes that can be confused with calluses or tendons, or maybe a tendon condition. And in many instances ends up being this condition where it's actually thickening and scarring of the skin and the layer of tissue underneath the skin. And this can present as nodules or masses that almost feel like a marble or a knot in the skin. Can be confused for a cyst. And it can even look and manifest as cords that will begin to look like they extend into the finger and start to bring the fingers down and contract the fingers. The treatment options for Dupuytren's, we have several great options to treat this. Unfortunately, this is a condition that has a mind of its own. It will progress at its own rate. There's nothing that we have the ability to do to slow this progression as it will progress over years or decades in someone's hand. And there is research that's looking at, is there a pill that we can take that will be able to turn off the cells that overproduce this scar tissue so that we won't ever have to do anything invasive or any surgery for this again. And I look forward to the point in my career where that will be an option for this. But for now, the options for this include, there are needle options where we can use a needle in the office where we are able to disrupt the cord and the scar tissue. And simply by just using a needle to poke through the skin, a quick 1 or 2 minute procedure in the office can release the contracted cord. And within minutes, we can have a patient who's comes into the office, like this or like this, and we can release that. There are some advantages to that. There are some drawbacks to that. There is also an option where, depending on the manifestation of this condition, we can inject an enzyme that can work to dissolve some of the scar tissue that's in there, and that's oftentimes followed by a procedure where we sort of can break open some of these contractures that set in. Oftentimes, depending on the extent or the extensive nature of the disease or the condition, surgery ends up being an option for this as well. And surgery is another low risk, very highly successful option to treat this condition. Someone can come into surgery with years or decades of a hand that's been contracted down like this, and within 20 or 30 minutes, we have to make an incision, but we can remove all the scar tissue that is contributing to the contractures, and it can be highly satisfying and rewarding for a patient to walk in to the surgery or procedure with a hand like this, and then a half hour later have complete full extension of all their fingers, and that is a condition, and the treatment of which is often followed by some on and off splinting, usually at nighttime, while the tissue is healing, to allow it to heal in a extended position. And oftentimes there is a little bit of stretching that goes along with that one after the surgery to make sure that the excellent results in terms of the correction are maintained. Trigger finger is certainly one of the most common conditions that I see and treat. And it's something that can affect any of the fingers and the thumb. And again, what this is related to is pressure. This is pressure of the tendons that help move the fingers and the thumb. And with normal use, normal aging, certain other conditions or injuries, what can happen is the tendon, as it's leaving the palm and entering the finger, can get tightly squeezed by tissue there, and the tendon can get inflamed. The space it's passing through can get closed down and can get tighter, and then it can be very painful to get that tendon moving in and get the finger moving. The tendon will continue to swell to the point where it'll be so swollen, it'll have trouble popping in and out to be able to move the finger. And so that can even turn into people unable to either make a fist, or if they make a fist, they can't release it, or they release it, but some of the fingers won't release because the tendon is too swollen to move. And even sometimes they'll have to pry the fingers open. This can be a very painful, very debilitating condition. And I guess I would say the nice thing about it is we can always resolve it, and no matter what. The treatment of this it can be aimed at resting the tendon using a finger splint periodically to allow the tendon to rest. There can be anti-inflammatories that are used, taken as pills or topically. It's a condition that responds very predictably well to an injection of anti-inflammatory. So oftentimes we hope not to have to do any surgery to cure this condition, as many of them will respond simply to an injection of anti-inflammatory, which will work to shrink the swelling and the inflammation around the tendon and of the tendon itself, create more room for it so that it can glide in and out without being abraded and without being squeezed and irritated. For those who this condition recurs, or maybe the injection doesn't resolve it completely, it's again one that has a relatively simple surgical solution, which is again a quick little 5-minute surgery with a small incision that is aimed at simply releasing the pressure off of that tendon, which seems to be a common theme here that you're hearing about pressure and what pressure can do to cause some of these problems around the wrist and hand and fingers. Cubital tunnel syndrome is one of the most common nerve compression conditions that affects anybody's arm. Second most common only to carpal tunnel syndrome. And what causes this is very similar, some differences. This is a different nerve. It's the ulnar nerve, and this is the nerve that affects the hand and supplies the hand on the pinky side of the hand, as opposed to the carpal tunnel nerve, which will predominantly supply more of the thumb and the index finger side of the hand. This nerve will get irritated and compressed as it's passing by the elbow. And this one is more susceptible to things like motion and keeping the elbow in a flexed position, which can exert more pressure on that nerve. But ultimately, it does boil down to the issue being pressure. And the treatment of this condition can be approached with either splinting and bracing, which you can splint and brace the elbow in a semi-extended position that has been shown to exert the least amount of pressure on that nerve, similar to this different splint we use for carpal tunnel syndrome. And then for patients who that doesn't resolve the issue, injections, anti-inflammatory injections can be an option as well. And then the gold standard definitive treatment for this, again, is the surgery, where the surgery is aimed at, again, we make a small incision, and that incision is located kind of on the back side of the elbow, and make a small incision to get underneath the skin, and then underneath the skin from about there, kind of up to the mid portion of the arm, we're taking the pressure off of this nerve. And it's removing the pressure from this nerve that helps resolve the symptoms that can be related to pain, numbness, tingling. This is a nerve that controls most of the muscles of the hand. So this one also comes with a greater sense of weakness or clumsiness. Arthritis affecting the wrist is a very common condition that can kind of present as hand pain, wrist stiffness. This arthritis of the wrist, because the wrist is really not just one joint, but it's, as you can see from the x-rays, multiple different joints, both of the hand and of the forearm. And so arthritis of the wrist can really present as several different types, several different locations, whether it's more on one side of the wrist or the other. This is an x-ray of an individual, and if their hand is positioned like this, it's more on the thumb side of the hand. And you can see that some of the normal joint spaces, whereas there's a lot of joint space out here and in some of the joints of these knuckles, you can see that joint space has worn down, and portions of this joint are at bone-on-bone arthritis in this individual's wrist. And so depending on the location and the severity of where this is located around the wrist, the options include things like therapy and bracing. Injections are successful on a temporary basis, and there are multiple surgical options as well that we aim to do what's called motion preserving alternatives. We don't like to do the wrist fusion at all, even though there's plenty of those that are still done. Nowadays, we have more advanced techniques and ways to treat arthritis, even bone-on-bone arthritis across the wrist, without having to do wrist fusions. And those would include things like bone removal, using tissue to interpose between some of the surfaces that are approaching bone-on-bone. And patients tend to really do well from addressing the pain that the wrist degeneration will bring, while also maintaining their ability to maintain the motion and the use that they have of the wrist. And then the last issue I'll discuss here is one that sometimes can affect the outer portion of the wrist, maybe at the base of the pinky on that side of the wrist. And this one we typically refer to as ulnar-sided wrist pain. On this x-ray here, if this is an individual's hand like that, what we're addressing is some of the issues that happen more on the pinky side of the wrist. There is a joint where the bump of your wrist is located. That bone forms a joint that participates in the rotation of the wrist and the forearm like this. And so what can happen, and this x-ray shows it on this individual, is that joint here where these two bones rotate around each other is also susceptible to degeneration and wear and tear, and can get to the point where there is even arthritis and bone on bone happening at that location. Additionally, there is soft tissue and cushioning ligamentous tissue that absorbs force and impact that's predominantly located on that side of the wrist, that as the years go by and as wear and tear happens, yes, it can happen to the bone and the joint, but it can also happen to some of the soft tissue in this location. Soft tissue, which of course we can't see on the x-ray, but the soft tissue in here is also very prone to degeneration, and that can be a very common cause, even in younger people who have normal appearing x-rays, to have pain and disability coming from some of the soft tissue issues that can occur on that side of the wrist as well. So there's, depending on what some of those symptoms are, a lot of the treatments for that can include therapy and hand therapy, which is very successful at improving that either tendon or ligamentous or joint pain on that side of the wrist. There's even arthroscopic surgical options where we go in with small cameras and small instruments through very small little incisions, and we are actually able to clean out that area from inflammatory tissue buildup and some of the degeneration that will happen inside of the wrist and in some of the soft tissues around the wrist. And that can be a very successful procedure, very low risk procedure to really give a new lease on life for somebody's wrist if they're struggling with chronic wrist pain as well. So I thought it might be nice to go through that list of 10 common things. If anybody has any questions or comments, I'd love to field some of those.